Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I'm going to talk about prior authorizations for prescriptions. There are many different reasons why a medical practice would need to work on prior authorizations for patients, and one of them is for prescriptions. There are so many different prescriptions out there. There are new ones coming every day. And depending on how new the prescription is, if the patent is still new or existing with the original release or they extended it, there's multiple different reasons why a prescription would need a prior authorization, but it does all come down to usually the cost of the medication, how often it needs to be used, and also how a prescription is classified at a patient's insurance coverage. So there's different tiers of prescription coverage under every patient's prescription plan, whether they have Medicare Part D, a Medicare Advantage plan, or commercial, or even Medicaid. And depending on the tier, it will dictate what needs to be done in order to obtain the medication. There are hundreds of medications out there that don't require a prior authorization at all. They are generics or they've been on the market for a really long time and they're pretty affordable, and you just prescribe the medication for the patient and they can go pick it up and start taking it. And then you have others that, like I said, are newer or for some reason requires a prior authorization because it costs more. And in that situation, the insurance company wants to make sure that the patient qualifies to their standards to take the medication. Because of this, there's different criteria that's required to submit in prior authorization information for every different type of medication. In the old school days, back when I was working the floor and patient care, when we didn't have so much automation, we had to do a lot of stuff by hand or over the phone. And we'd fill out generic applications, prior authorization information sheets, and we'd submit them via fax, or if it was more urgent, we'd get on the phone and we'd give the information that way. Now there are portals that help us enter all the information and it saves it for next time, which is really nice. But also because of the data interchanges that are existing between electronic medical records and pharmacies and insurance companies, we are able to get more information on what insurances are requiring specifically for certain patients' prescription benefits, and then be able to submit the information online. A big proponent and one of the most popular portals that are used by most pharmacies and interface with EMR companies is Cover My Meds. So covermymeds.com, if you work in a doctor's office and you get prior authorizations, you're probably very familiar with them. But they are super handy because when a prescription is sent to the pharmacy for a patient and it requires a prior authorization per that patient's prescription benefits, they will send you notification that a prior authorization is needed. And then what you will do is complete the form they attach with it. And it's specific to that insurance company most of the time, not all the time, but it's specific to either that specific insurance company's requirements for that medication or that family of medications. Sometimes it's a document that's specific to that medication and it can go to all insurances, but nonetheless, they usually include what you need to fill out and then you can submit it in real time. And because Cover My Meds does interface to a lot of EMR systems, you can do it right through the EMR. If not, you can go on to the Cover My Meds portal and do it that way. It's super simple. If you work in a doctor's office, you qualify to have set up your own login and go that route. But you have to prescribe the medication and get it sent to the pharmacy in order for it to trigger the need for the prior authorization. So you can have your staff get everything ready to submit the authorization, knowing certain meds are going to require it. But at the same time, in order for it to be triggered at the insurance company for the patient's benefits, it does need to be submitted. So the first step is submitting that medication to the pharmacy for the patient. Then once you receive that notification, you fill out all of the information, someone in the office does, and submit it. And then you just follow up on it, waiting for the decision. The information that's needed that you need to submit is very specific to the medication in some ways, but there are other criteria that need to be always submitted on these. So, of course, you're going to need to submit the patient's name, date of birth, probably their other demographics like street address, so they can identify the patient accurately in the insurance database. You're also going to have to include their insurance information, which is hopefully pre-populated already from the pharmacy, but if not, you would have to put their plan name, their insurance name, the subscriber ID, etc. Then you would need to make sure that you are putting the medication name that you are trying to get the authorization for. You would need to put the dose. You need to put how frequent the patient is to take it, so the directions of the medication, right? And then the quantity per month that you're asking for. So if it's 30 for 30 days, if it's 60 for 30 days, or maybe it's 90 for 90 days, however you're going to be requesting it. And if you don't have this information, the doctor or the prescriber should be giving you this information. Then once you do that information, it's going to have specific questions to the medication most likely. And it's going to ask you what medications have been tried and failed before, how long they took that medication, what was the dose and frequency of taking that medication, because they want to see if there have been, quote, step edits taken and failed before prescribing this medication. Some of the other questions that might be asked, and it's also pertinent information to put on the prior authorization application if it doesn't ask, is if the patient has ever taken the medication before, because maybe you're just renewing a prior authorization, so it's just a new, the old one expired and you need to get a new one, or maybe they have a new insurance where they were approved on their last insurance plan, but now they have a new insurance plan that requires prior auth. So you need to let them know the patient has been taking this medication, we're just continuing therapy, and we need a renewed prior authorization. So that's really important. So if it doesn't ask you that, you want to make sure you put that on there. Again, like I said, the step edits, what medications in the same family of meds have been tried and failed. Hopefully the doctor, the provider, the prescriber has documented that. If not, you need to ask them to, because it should be in their medical records. Somewhere in their prescription history even will be helpful. You could use that as a resource to see how long they've been taking it, the dose. They're also going to ask if you're okay with giving them like a brand name or a generic. Now, most new medications don't have a generic yet, so most likely it's going to be a brand name, but that's not always the case. So make sure you specify if you are okay with them having the generic equivalent or the brand name is required. And sometimes the prior authorization is specifically to get the brand name because the patient doesn't tolerate the generic. That's common. But again, give the reason why the patient didn't do well on those step edits. Was it they couldn't tolerate it? It's a contraindication, so they can't even try that medication because of something else they're taking or a condition they have. There's so many different things out there. And you do need to have a clinic knowledge of answering these questions. So if you're not sure, don't ever guess. Make sure you ask a medical professional, somebody who understands it, because this could be a patient safety issue and it's patient's health, right? And then you put any additional comments, diagnoses, anything in there that they ask for or they give an option for you to provide. And the doctor, the prescriber, has to sign the application, whether it's digitally or wet signature. It will indicate what they want, but most likely they will have to sign it. If not, then that's fine. But if there is a place for them to sign and date it, make sure you have that done. If you miss answering any of these specific questions they're asking you, they will deny it. So you have to make sure you complete this form in its entirety, because if you don't, it could prolong this process. And the longer you prolong this, the less likely this patient is going to have their medication. So either they need this medication really bad because they've been on this med and they are going to run out, or they have ran out, or they're suffering from something that this medication is going to help with. So nonetheless, you want to make sure you're detail-oriented and thorough as possible, because this is a patient's life that you're dealing with. So you submit it and you wait for the return on the decision. And once it's decided, if they authorize it, the pharmacy should know because they put it in the patient's account, like insurance account. So when they try to send that coverage again, it will approve it. But I always needed to know and make sure that the pharmacy got it. So I would either fax the approval to the pharmacy or look for notation somewhere that it says the pharmacy's been notified or our system has been updated to reflect the prior authorization. So I knew I could let the patient know it was approved and they wouldn't have any issues when they went to the pharmacy to pick up their medication. So it's closing the loop on that and just making sure everybody is aware so it doesn't delay treatment even further for the patient. If it does get denied, then you would need to go back to the prescribing doctor or provider and say, hey, look, this happened. Usually they'll give you a reason why it was denied, and you can share that with the provider and figure out a game plan from there. But hopefully you fill out everything as thoroughly as possible, they qualify, and they can get the medication. Now, the one thing that you want to make sure you communicate to patients is that just because the insurance approved it doesn't mean it's going to be affordable. And a lot of patients don't realize that when a prior authorization is obtained, whether it's for a medication, advanced diagnostic imaging, a different treatment plan, or treatment option, that it's going to be affordable. They think because the insurance approves it, it's going to be priced at a fairly decent level. And that's not the case. And then they get sticker shock. They get really frustrated because they've waited all this time to get the approval and they finally feel relieved to go get the prescription. And they go and they tell them how much it is and they're really upset. So make sure that you give them a heads up about that as a courtesy because they don't understand. If you have any questions or comments about this, please leave that in the comments below. This is a very important process. You should have a very strict, streamlined workflow established at your office for this because of the patient factor. Again, any comments, questions, leave that in the comments below. I'm happy to try to help. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with your colleagues. Thank you so much. We'll see you next time. Bye-bye.